Okay, good afternoon, sir. Can you hear and see me clearly?
Yes, hear you.
Okay, so I'm your pharmacist this afternoon. My name is Rick Gao, and for confirmation, can you please tell me your name?
I'm the Bob Lee.
Okay, thank you. And based on your medication profile, I learned that you are currently having a gout, right?
Right.
Okay, can you tell me how is your condition right now?
I still feels good, but I'm still distracted to the wall.
Okay,
Yeah,
so you still have difficulty to walk,
yeah,
right?
to walk.
Okay,
Okay,
I understand. So before I go through your medications, I have a couple questions to ask you. Okay,
okay.
so the first question is, have you ever told by the doctor that you have kidney or liver function problems?
Yeah,
No?
I got it.
Okay.
I got it.
Do you have any, are you allergic to any other drugs?
No, no, I like.
Okay. Are you currently using any other medications?
No,
No, okay. Do you have any other diseases such as diabetes, high blood pressure?
no.
Okay, thank you. So I'll now go through your medications. So the first drug is Fiburic. Do you see it in your drug package? It's
Yeah,
a light yellow tablet. Okay.
yeah.
So the doctor prescribed you to have a half tablet per day. So you have to break the tablet into half
Huh?
whenever you take this drug. And this drug is the purpose of this drug is to reduce your uric acid. Okay, and uh, there are some side effects I want you to pay attention on when you're having this medication. The first one is skin rash. So if you have skin rash after taking this medication,
Hmm.
I want you to pause for the next dose and go right back to your doctor immediately.
Yes.
If that is a serious rash, or if it's a mild rash, you can have a little care for it and see if it's going to be a little serious. If it goes serious, then you have to go back to your doctors immediately. And then you might still have some pain in your joint because it's a process of lowering your uric acid. So that is going to help you to reduce your uric acid. And when time moves on, the pain will gradually go away. Okay.
Okay.
So the next medication is colchicine. It's a light blue disc tablet. Okay. So the doctor prescribed you to have this tablet one tablet and for 3 times a day. So that is in the morning, in the afternoon, and in the night. You can have it with food, it's okay. It will alleviate your gout symptoms. And there's one thing I want you to remember is that when you are having this medication, you don't go with fruit grapefruit juice.
Uh
You
huh.
don't drink this juice. Okay, and the third medication is Indoid. It's indomethacin, and it's also a capsule. And you take one capsule a time and have it 3 times a day. Okay, and it will ease your pain because now you told me that you still have difficulty in walking, right?
Yeah.
Okay, so if you take this medication, maybe a few days later, you don't feel any pain, you don't have any difficulties in walking, you don't have to have this medication. It's okay. But the previous two medications, you still have to have these drugs. Okay? And another thing I want to discuss with you is that can you tell me about your eating habits?
Normally, I quite often with me had many meals with a different the
Okay.
crimes. So that's why I prefer uh, meat and seafood at
Uh-huh.
my fancy restaurant.
Okay.
Okay, I prefer my Coca-Cola too. Coca-Cola for drink.
Okay.
Yeah, for drink.
Okay. So what you mentioned is that you like to have seafood and meat, right?
Yeah.
And actually, those diet is not going to be helpful for your symptoms. You have to cut back on these intakes.
Uh huh.
Okay.
Okay.
So in alternatives, maybe you can have some
So what?
low fat milk as protein resources or eggs. But for eggs, you can only have like 3 eggs a week. Okay. And also another good protein resource is chicken breast.
Chicken breast.
Yeah. So
Mm-hmm.
if you still have some dining opportunities with whoever you're having dinner or dine with, you can order chicken breast instead of steak or lobsters or other seafood. Okay. And also you mentioned that you like to drink Coca-Cola, right?
Yeah.
Okay. And Coca-Cola actually contains a high amount of sugar. So
Mm-hmm.
actually, that is not very good for you.
I see.
But since you told me that you like to drink Coca-Cola, and I think it's very difficult for you to not drinking it,
Yeah,
right?
yeah, yeah.
Yeah, I
So
understand.
yeah, so what can
So,
I do?
so you can choose zero sugar Coca-Cola if
Uh-huh.
it's available for you, or I think for a zero sugar Coca-Cola, it's just an alternative. But because if I ask you to cut down Coca-Cola right away,
Right, right. Yeah.
it's not going to be easy. So you have to gradually stop drinking cola.
Okay.
And zero sugar is only a alternative. I also recommend you to drink a lot of water.
Right.
That's my main goal. You have to change from Coca-Cola
Coca.
to zero sugar, and
Yeah.
then finally go on to drink water. Okay?
Okay.
And actually, I recommend you to drink water of at least 2,400 millimeters a day.
A day?
And can you
Okay.
do that?
Yeah. I'm gonna try it.
Okay, great. And as for another symptom I want you to remember is that if you have any chances when you have going to the bathroom and you see any red urine and or a pain in your back waist, you have to go back to the doctor
I see.
because that's a symptom that you are having a uric stone in your kidney, and that's a serious problem. I want you to keep in mind. So if you have come across in any of these, you have to go right back to your doctor. Okay, and one last thing for you to know is that exercise right now might not be a good choice for you because you have difficulty in walking, right? Yeah. So maybe doing some yogas or maybe some mild exercise is good
Mm.
for you because I want you to cut down to lose some weight
To lose some
because
weight.
uh, now you are a little overweight.
Mm-hmm.
I would say that.
Yeah.
And your ideal weight would be around 65 kilograms. So I think it's best for you to lose some weight and it will do good for your disease control.
Yeah.
Okay?
Huh.
Okay. And one other thing is that while you're taking Fiburic, I want you to keep in mind, do you have any chest pain or difficult to breathe? Because taking this medication, we have a cardiovascular risk. So if you're experiencing chest pain or difficult to breathe, I also want you to go back to your doctor
Yeah.
and to discuss
Understand.
with him about the medications.
Yeah.
Okay. So do you have any other questions that you want to ask me?
So can I take this medication for lifetime?
Sorry?
take this
Or-
medication for the lifetime, for
Oh.
the whole my life.
This medication is actually for a short period control
Uh-huh.
because you experiencing acute flare right now.
Uh-huh.
So after the acute flare, you will have to go back to your doctor and see if he is going to adjust any medication for you.
Okay.
And if you still have any questions, you can always dial the numbers on your drug package and call right back for us
Okay.
for help.
I appreciate your advice. Thank you very much.
Thank you.
Thank you.
高子维, you made a good speech. Basically, a lot of items you get a full score, but just two items. Now, maybe you forgot to ask to tell the patient how to deal with if he forgot to take the medicine and how to the drug storage. Where to put the drug to not to expose to the heat or to water. So basically you get high scores. Good. And also good English expressions.
Thank you.
要下一位吗？还是？学长讲的吗？
对，换我好 ，OK， 好 ，OK， 紫薇哈，So basically， 我觉得I think you performed better than you did this morning.
Okay.
Now, I don't know why, but I didn't say that you didn't perform well in the morning, but I think you performed much better now.
Okay.
In 英文组 so
thank you.
Okay. So basically, I think you collect all the information that you need quite sufficiently, and also I think you ask a lot of information that you would need during your counseling. So I think that's some really great point. But I want to make sure that did you notice that the patient's renal function is not really good?
Yeah, I understand that his creatine tolerance is around 33, but I do the research because abusive state and Pce when his creatine tolerance is above 30, it doesn't require dose adjustment. So I didn't mention that in my consulting. But I do realize that he is not having a good renal function.
Renal function, okay. So, yes, you're right. So, at this moment, the patient doesn't need any dose adjustment. But because we know that renal dysfunction is not a reversible science, right? So it will get only worsen in the future. So you can also remind the patient that make sure he tells other his doctor, or in the future if you go to see other doctors, make sure other doctors know that his renal function. The problem is renal impairment. Yes.
Because he's also taking NSAID, right?
NSAID, right? Yes.
Okay.
Cool. Okay. So basically, about lifestyles counseling, you did a really good job on suggesting the patients to take some protein from maybe chicken breast, eggs, low-fat meals. These are all good. And also you mentioned about the Coca-Cola. Yeah, because you know that it's hard for him to like completely cut off his cola at this moment. So you suggest him to change to zero cola, right? First.
Yeah.
And then in the future, maybe we'll see if he's able to completely replace cola with other drinks. That is really a good idea, and it's really useful in counseling. Yeah. This technique is really useful in counseling. Okay.
Thank you.
One more thing. So you mentioned that the patient should beware if if he sees anything red during when he's in his urine, right? So you said that that's a symptom you are having. What do you say? Kidney stone or what?
I think I said uric stone.
Uric stone. Okay. Okay. Because you said you used the word that is a symptom. So usually we would say, oh, that might be a symptom.
Oh.
Yeah.
Okay.
Suggest him to go back to the doctors
To
make sure
confirm.
because
Okay.
because it might be
Other
UTI.
reasons.
Yeah, it might be an
Oh,
infection or something. It's not exactly
okay.
a stone or uric stone or something. Yeah,
I
but
understand.
but that's okay lah. So good. Okay.
Okay. Thank you.
Thank you.